Your penis might be shrinking right now, and you'd never know until it's too late. Not from chemicals in the environment, not from some mysterious toxin. From 6 daily habits you're probably doing today that are quietly destroying the blood vessels, damaging the erectile tissue, and causing permanent structural changes that make your penis physically smaller. And here's what makes this so alarming. The damage happens silently. No pain, no warning signs, just gradual, irreversible shrinkage that you won't notice until months or years have passed. Research shows that up to 70% of men who undergo certain treatments experience penile shrinkage ranging from half an inch to 3/4 of an inch. Studies tracking men with high BMI found a direct link between weight gain and reduction in erect penile length. Analysis of 274 patients with penile measurements found that older men experience more penile atrophy, with atherosclerosis, the hardening of arteries, causing changes in penile collagen that make erections difficult and contribute to shrinkage. But the most alarming part? A 2021 Italian study of thousands of men found that smokers were significantly more likely to have below-average penis circumference. And men who don't get regular erections can lose 1 to 2 centimeters of length in just 3 to 6 months. That's up to 3/4 of an inch, gone permanently. Today, I'm revealing the 6 daily habits causing this damage, the exact biological mechanisms destroying your penile tissue, and what you need to stop doing immediately to prevent permanent shrinkage. Hello, gentlemen. I'm Dr. Jocelyn, a urologist with over a decade of clinical experience helping men preserve erectile function, maintain penile health, and prevent the structural damage that leads to permanent size reduction. Today, I'm exposing 6 common daily habits that are scientifically proven to cause penile shrinkage. These aren't rare behaviors. These are things millions of men do every single day without realizing the permanent damage they're causing. Before we begin, please hit that like button right now. Are you concerned that any of your current habits might be affecting your penis size or erectile function? If yes, type 1 in the comments. Your answer helps me understand what concerns men like you most. And please subscribe so you never miss critical information that could protect your sexual health. Now, I need you to stay with me until the very end of this video, because by the end, you'll understand the exact molecular pathway that causes permanent shrinkage. You'll discover which common medications are secretly destroying your penile tissue right now. You'll learn the specific timeline of how fast damage occurs, so you know exactly how urgent this is. And most importantly, I'll give you a complete prevention protocol that can stop and even reverse early damage before it becomes permanent. Let me show you exactly what's happening to your penis at the cellular level and why these habits are so destructive. Understanding what causes permanent penile shrinkage at the tissue level. Before I reveal the 6 habits, you need to understand what actually causes permanent penile shrinkage at the tissue level. Your penis contains 3 cylindrical chambers. 2 large chambers, called the corpora cavernosa, run along the top and sides. 1 smaller chamber, called the corpus spongiosum, surrounds your urethra and forms the head of the penis. These chambers contain specialized erectile tissue made of smooth muscle cells, collagen fibers, and a complex network of blood vessels. When you're aroused, blood floods these chambers, the tissue expands, and you achieve an erection. Mechanism 1: smooth muscle cell death and fibrosis. When erectile tissue doesn't receive regular oxygen-rich blood flow, the smooth muscle cells begin dying through a process called apoptosis, or programmed cell death. Research shows that erectile dysfunction is associated with loss of smooth muscle cells, and an increase in fibrosis has been repeatedly reported in the corporal tissue of patients with ED. Dead smooth muscle cells don't regenerate. Instead, they're replaced with dense fibrous scar tissue made primarily of collagen types 1, 3, and 4. Studies demonstrate that transforming growth factor beta-1, a pro-fibrotic growth factor, increases collagen synthesis in human corpus cavernosum smooth muscle cells in culture. And this process is induced by hypoxia, or low oxygen levels. The mechanism works like this. Hypoxia induces transforming growth factor beta-1 expression, which stimulates collagen production while simultaneously inhibiting prostaglandin E synthesis, a compound that normally suppresses excessive collagen formation. This creates a vicious cycle where lack of oxygen triggers fibrosis, and fibrosis further reduces blood flow, creating even more oxygen deprivation. This fibrous scar tissue doesn't expand like healthy smooth muscle during erections. It's stiff, inelastic, and permanently shorter. Research tracking subjects after cavernosal nerve injury found that the smooth muscle-to-collagen ratio in erectile tissue was reduced by day 7 and bottomed out at 30 and 45 days, with smooth muscle cell death peaking at day 3 post-injury. Once advanced fibrosis develops, the structural changes become irreversible. Mechanism 2. Vascular damage and atherosclerosis. The tiny blood vessels supplying your penis, called cavernosal arteries, are incredibly delicate, with diameters smaller than those feeding your heart. When these vessels become damaged through oxidative stress, inflammation, or cholesterol deposits, they narrow permanently. Research demonstrates that atherosclerosis of the penis causes thickening or hardening of arteries and changes in penile collagen. The aging process itself causes decreased penile oxygen tension, and a reduction of smooth muscle cells has been demonstrated in relation to this change in oxygen tension. Here's the molecular mechanism. As smooth muscle cells steadily decrease in number, the corpora cavernosa show excessive deposits of collagen fibers, resulting in corporal fibrosis. These same changes occur in the muscular walls of penile arteries. When blood vessels become narrowed and stiff, they physically cannot deliver adequate blood volume for full erections. The collagen deposition occurs not just in erectile chambers, but simultaneously in penile arterial walls, creating both inflow problems from narrowed arteries and outflow problems from fibrotic erectile tissue. Mechanism 3. Collagen restructuring and loss of tissue compliance. Healthy penile tissue contains carefully organized collagen, providing structural support while remaining flexible and elastic. When tissue experiences injury, hypoxia, or chronic inflammation, your body deposits new collagen in a disorganized, dense pattern through a process called fibrosis. Changes in elastic fibers or collagen types provoke mechanical alterations of the penis, reducing its elasticity and compliance, the ability to expand under pressure. Normally, the remodeling phase of tissue repair leads to fibrinolysis, apoptosis of myofibroblasts, and breakdown of excess extracellular matrix. However, when this normal healing process fails, myofibroblasts persist in far greater numbers than in healthy tissue, continuously producing collagen. The abnormal collagen makes tissue shorter, stiffer, and less capable of expanding during erections. Now let me reveal the 6 daily habits causing this damage. Habit number 1, chronic sleep deprivation. This one surprises most of my patients, but insufficient sleep is one of the most destructive habits for penile health. During deep sleep, particularly REM sleep, you experience 3 to 5 spontaneous erections lasting 20 to 40 minutes each. These nocturnal erections aren't related to sexual dreams. They're your body's automatic maintenance system for erectile tissue, serving a critical oxygenation function. During these nighttime erections, oxygen-rich blood floods your erectile tissue, delivering nutrients and keeping smooth muscle cells healthy and alive. Without regular oxygenation, smooth muscle cells undergo apoptosis and are replaced with collagen-rich scar tissue. Here's the molecular mechanism. When penile tissue becomes hypoxic, oxygen-deprived, it triggers expression of transforming growth factor beta-1, a master regulator of fibrosis. This simultaneously increases collagen synthesis and inhibits production of prostaglandin E, which normally suppresses collagen formation. This creates a destructive cascade where hypoxia directly causes fibrosis. Research demonstrates that men who consistently sleep less than 6 hours nightly experience significantly reduced nocturnal erections over months and years. This chronic oxygen deprivation causes progressive smooth muscle death, myofibroblast accumulation, excessive collagen deposition, and permanent tissue shrinkage. One landmark study found that men who don't have any erections for 3 to 6 months lose 1 to 2 centimeters of penile length. When chronic sleep deprivation prevents adequate nocturnal erections, you're creating the exact conditions for this tissue atrophy. Dr. Jocelyn's recommendation: prioritize 7 to 9 hours of quality sleep nightly. Protect your sleep schedule as seriously as you protect any other aspect of your health. If you have sleep apnea, snoring, or difficulty maintaining sleep, see a sleep specialist immediately. These conditions prevent the deep REM sleep and the protective nocturnal erections your tissue depends on. Habit number 2, Sedentary lifestyle with no regular exercise. Sitting for extended periods without regular physical activity destroys penile health through multiple pathways. First, lack of cardiovascular exercise reduces your body's natural production of nitric oxide, the molecule essential for blood vessel dilation and erectile function. Without adequate nitric oxide, blood can't surge into erectile tissue effectively. Second, sedentary behavior increases visceral fat, the dangerous fat stored deep in your abdomen. Research shows that increased visceral fat negatively impacts erectile function and can lead to erectile dysfunction over time. Third, physical inactivity allows cholesterol and fatty deposits to accumulate in blood vessels throughout your body, including the delicate cavernosal arteries supplying your penis. This atherosclerosis permanently narrows these vessels. Studies demonstrate that men who exercise regularly maintain significantly better erectile function and penile tissue health compared to sedentary men. Dr. Jocelyn's recommendation: engage in cardiovascular exercise at least 30 minutes daily, 5 days weekly. Walking, jogging, cycling, swimming, anything that elevates your heart rate and improves circulation. Include resistance training twice weekly. Building muscle mass naturally increases testosterone production and improves overall metabolic health, both of which support erectile function. Even moderate daily walking dramatically improves vascular health and nitric oxide production. Habit number 3, consuming a diet high in processed foods and sugar. What you eat directly affects penile tissue health through vascular damage and hormonal disruption. Processed foods high in refined carbohydrates and added sugars cause chronic elevation of blood glucose and insulin. This metabolic dysfunction damages blood vessel endothelium, the delicate inner lining of arteries. When endothelial cells are damaged, they produce less nitric oxide and become inflamed. Inflammation triggers collagen deposition and fibrosis in blood vessel walls, narrowing the passages permanently. High sugar intake also increases advanced glycation end products, harmful compounds that accelerate vascular aging and tissue stiffness, specifically damaging erectile tissue elasticity. A 2021 Italian study found that men with high BMI showed reduction in erect penile length and that weight gain shortens flaccid penis length. The dietary habits causing weight gain are simultaneously damaging penile tissue directly. Dr. Jocelyn's recommendation: adopt an anti-inflammatory diet rich in whole foods. Emphasize leafy greens, which provide nitrates your body converts to nitric oxide. Include berries for antioxidants that protect blood vessels. Eat fatty fish for omega-3s that reduce inflammation. Eliminate or dramatically reduce processed foods, refined sugars, and trans fats. These foods directly damage the vascular system supporting erectile function. Think of every meal as either supporting or destroying your penile tissue health. Choose accordingly. If this information is helping you, please hit that like button right now. Habit number 4, taking certain medications without understanding their side effects. Multiple common medications cause painless penile shrinkage as a documented side effect, yet most men are never warned. Certain popular hair loss medications have been found in studies to cause penile shrinkage and other sexual dysfunctions. These drugs work by inhibiting 5-alpha reductase, an enzyme converting testosterone to dihydrotestosterone, or DHT. While reducing DHT helps prevent hair loss, DHT plays critical roles in maintaining penile tissue health and structure. Chronic DHT suppression can cause tissue atrophy and actual size reduction in susceptible men. Some men develop post-finasteride syndrome, where sexual side effects, including perceived shrinkage, persist even after stopping the medication. Selective serotonin reuptake inhibitors can reduce blood flow to the penis and affect erectile strength. According to Harvard Medical School, these medications reduce blood vessel responsiveness and can affect the strength and size of erections over time. Certain blood pressure medications, some antihypertensives, reduce blood flow throughout the body, including to penile tissue. Chronic reduction in penile blood flow leads to smooth muscle atrophy and tissue shrinkage. Dr. Jocelyn's recommendation: before starting any new medication, specifically ask your doctor about sexual side effects, including potential impacts on erectile function and penile tissue health. If you're currently taking medications known to cause these effects, discuss alternatives with your physician. Often, equally effective alternatives exist with fewer sexual side effects. Never stop medications without medical supervision, but advocate for your sexual health by requesting alternatives when appropriate. Habit number 5, ignoring uncontrolled chronic health conditions. Certain medical conditions, when left untreated or poorly controlled, cause progressive and permanent penile shrinkage. Poorly controlled diabetes causes multiple catastrophic types of damage to penile tissue at the cellular and molecular levels. It damages blood vessels by reducing nitric oxide production and impairing endothelial function. It causes nerve damage, specifically affecting the nerves regulating blood flow to the penis through a process called diabetic neuropathy. Most critically, diabetes triggers severe inflammation in penile tissue. Research demonstrates that in the corpus cavernosum of diabetic patients, vascular smooth muscle apoptosis is markedly increased, while smooth muscle content is decreased, and fibrosis is dramatically increased. The molecular mechanism involves upregulation of the transforming growth factor beta-1 SMAD signaling pathway. Studies show this pathway plays an important role in erectile dysfunction by inducing fibrous muscular structural changes, with healthy smooth muscle tissue systematically replaced by dense collagen. The longer diabetes remains uncontrolled, the more smooth muscle you lose, and the more irreversible fibrosis develops. The corpora cavernosa develop excessive deposits of collagen fibers. Smooth muscle cell numbers steadily decrease, and these same histological changes occur simultaneously in penile arterial walls, creating both tissue and vascular fibrosis. Uncontrolled hypertension damages the endothelial lining of blood vessels throughout your body. In the penis, this damage reduces the vessel's ability to dilate and deliver adequate blood flow. Over years, uncontrolled hypertension causes progressive vascular damage and tissue atrophy that cannot be reversed. Untreated sleep apnea prevents deep REM sleep and the protective nocturnal erections that occur during those sleep stages. It also causes chronic oxygen deprivation throughout your body, including penile tissue. Men with untreated sleep apnea experience accelerated erectile tissue damage and progressive size reduction. Dr. Jocelyn's recommendation: if you have diabetes, maintain your hemoglobin A1C below 7 through diet, exercise, and medication if needed. Monitor blood sugar regularly. Take this seriously. If you have hypertension, keep blood pressure consistently below 130/80 through lifestyle modifications and medication. Your penile blood vessels depend on it. If you snore heavily, wake frequently, or feel exhausted despite adequate sleep time, get evaluated for sleep apnea immediately. Treatment with CPAP can prevent progressive tissue damage. Comment below right now. Do you have any chronic conditions you've been putting off treating? Habit number 6, allowing excessive weight gain, particularly abdominal fat. Weight gain causes both apparent and actual penile shrinkage through multiple mechanisms. When you gain weight, particularly in your lower abdomen, fat accumulates in the suprapubic area above your penis. This fat pad literally buries the base of your penis, making less of the shaft visible externally. Studies show some men lose up to 1 inch of visible penile length due to suprapubic fat accumulation. While the penis hasn't physically shrunk, the functional and visible loss is very real. Research from 2021 found a direct link between high BMI and reduction in erect penile length. And this isn't just visual. Excess body fat causes hormonal changes, particularly increased aromatase activity, converting testosterone to estrogen. Lower testosterone and higher estrogen disrupt the hormonal environment that maintains penile tissue health. Visceral fat also promotes chronic systemic inflammation, damaging blood vessels and erectile tissue. Additionally, obesity is strongly associated with diabetes, hypertension, and vascular disease, all of which independently cause penile tissue damage and shrinkage. Jocelyn's recommendation: addressing weight gain isn't about aesthetics. It's about preserving functional penile tissue. Even a modest reduction in body weight of 5 to 10% can meaningfully improve vascular health, testosterone levels, and erectile function. Combine dietary improvements with consistent physical activity. As visceral fat decreases, penile visibility improves, and the hormonal environment supporting tissue health is restored. The complete prevention protocol. As a urologist, I want to leave you with a clear, actionable framework. because understanding the problem is only half the work. First, protect your sleep. 7 to 9 hours nightly, with evaluation and treatment for sleep apnea if needed. Those nocturnal erections are not optional. They are your body's built-in maintenance system. Second, move your body every single day. 30 minutes of cardiovascular exercise 5 days per week is not a luxury. It is vascular medicine. Third, eat to protect your blood vessels. Every processed food, every excess gram of sugar is a direct assault on the endothelium supplying your erectile tissue. Fourth, review your medications with your doctor. Ask specifically about sexual side effects and request alternatives when they exist. Fifth, manage your chronic conditions aggressively. Uncontrolled diabetes and hypertension are among the most reliable predictors of irreversible penile fibrosis I see in my clinical practice. Sixth, address your weight. Not tomorrow, not after the holidays. Now. The structural changes I've described today begin slowly and quietly, but they compound over time. The research is clear, and the biology is unambiguous. These 6 habits are not minor inconveniences. They are active contributors to permanent, irreversible structural changes in penile tissue. The good news is that early action can stop the progression, and in many cases, begin to reverse early damage before it becomes permanent. I'm Dr. Jocelyn, and my commitment is to give you the clinical information you need to make informed decisions about your health. If this video helped you, please like, share, and subscribe. Leave a comment below. Tell me which of these 6 habits you're going to address first. Your health is worth protecting. Start today.